Hello guys, my name is Isaac, Simple and Real. Thank you for tuning into my channel. Kindly, if you have not yet subscribed to my channel, please subscribe, like and share. This is a channel where we should talk about issues concerning averting HIV and sexually transmitted infection stigma in our society. And we should say that being positive about HIV is not necessarily being HIV positive. Thank you. Guys, we have talked so much about averting HIV stigma, and also we have also talked about how we can be able to manage HIV so that it can be a disease like any other, or an infection like any other, being able to manage it appropriately. Some of the preventive measures that have been highlighted in various forums includes pre-exposure prophylaxis to prevent persons from acquiring HIV, using barrier methods or use of condom to prevent HIV transmission, and also we have using treatment as prevention, whereby people or persons who are HIV positive take their ARV medication appropriately, suppress their viral load, and they cannot be able to transmit the virus to those who are not yet infected. However, we also have other preventive measures, which example of them is post-exposure prophylaxis. Imagine you had unprotected sex with a person who is not adherent to his medication and he or she is HIV positive, or you had a needle prick injury and the person that you had pricked and you pricked yourself, you do not know their HIV status. You could be at a risk of acquiring HIV virus. Now, for such cases and other risks, including unprotected sex with person who you know or you do not know their HIV status, needle prick injuries, contact with blood fluids or other body fluids, including semen and vaginal fluids, with persons who you do not know their HIV status, or those who are HIV positive and are not virally suppressed, you could be risking yourself from acquiring HIV virus. Now, in case you have gotten to this kind of risk, what are you supposed to do? Number one, visit any healthcare facility where they do HIV testing and get tested. If you are tested and you turn HIV negative, you are now eligible for post-exposure prophylaxis, provided you have attended the healthcare facility within 72 hours of exposure. Number two, after you have been tested within 72 hours and you turn HIV negative, you are cancelled on adherence to the medication that you are about to receive. Remember, the medication that we give varies with age and with health status of the person who is supposed to take the medication. That is post-exposure prophylaxis. For instance, the regimen that we give for children that is below 30 kilograms is not the same post-exposure prophylaxis regimen that we give to an adult above 30 kgs with competent renal system. Are we together? And also, the regimen that we give to an old woman with the renal and hepatic injuries or chronic conditions, chronic renal and hepatic condition, is not the same that we give to a young person with competent renal and hepatic system. So you see, there are some differences that may arise. Now, what are you supposed to do? After this, we may request some tests to check your renal function or your hepatic function, and also we teach you on how to behave while taking this medication which is usually taken for about 28 to 30 days. Now, after we give you the counseling, the third thing that we give you is the medication. Now, the commonly used ARV regimen as post-exposure prophylaxis is this kind of drug. I don't know whether you can be able to see it. It's a fixed dose combination tablet that is usually made of three types of regimens. We have number one, dolutegravir, which is usually 50 milligram in this tablet. Number two, we have lamivudine, which is 300 milligrams in this same tablet. And we also have tenofovir, 300 milligrams. So this tablet is 3-in-1. It is very effective in the management of HIV virus, so it can be used in treatment and also as a post-exposure prophylaxis. Remember when I was talking about the HIV virus life cycle, which you can be able to see it in my previous videos, you will be able to understand how these drugs work regarding the life cycle of HIV virus. So this drug, you will be able to take it for at least 28 to 30 days. The advantage of this tablet is that it has very few or very minimal side effects. And also, you can be able to take this medication and continue with your work. Are we together up to this point? Thank you. The other thing is that taking post-exposure medication is not a reason for you to be stigmatized. Anybody can be able to take these drugs, and taking these drugs does not mean that you are HIV positive. You can take them as a treatment medication, or you can take them as a preventive medication. That is for instances of post-exposure prophylaxis. Are we together up to this point? Thank you. Now, let me talk about how do you take this medication. This tablet is not chewable. You only swallow it. It is not very big in size, so it is easier to swallow it. Number two, it's a coated tablet, so it does not leave a bitter taste or a sour taste or any unpleasant taste in your mouth while you're taking it. So it does not affect your appetite while you take it. Are we together up to this point? This is very important for anyone who has never taken them and they have exposed in a risk within 72 hours for them to take them to prevent them from converting to HIV positive and now take these drugs for life. Remember, you can take them for 28 days and prevent, or wait to take them for life for the management of the virus. So what I would like to advise everyone, if you get any exposure, these drugs are offered at any government healthcare facility free of charge, and also they are effective in preventing you from acquiring HIV virus. And I'm only talking about this today. And if you have any other question that you would like me to explain or to expound more about, please drop it at the comment section. I'll be able to respond to you appropriately. Thank you. My name is Isaac, Simple and Real. Kindly, if you have not yet subscribed to my channel, please subscribe, like and share. God bless you. Bye bye.